Okay, moving on to the school age child. Oops, went too far. So these children are between 6 to 12 years old. Um, they start to be more engrossed and focused on fact versus fantasy, develop peer relationships, so friends, best friends, often judged by their performance, and sense of industry, um, or being productive, and development of positive self-esteem directly influenced by their peer group. So they develop these close peer relationships, and their self-esteem is highly dependent on how they're judged by these peer relationships. Um, these are the stages for the school age child for Erikson, Freud, and Paget. So, stage of industry, sexual latency, and concrete operations. And that's on a different developmental theories chart. Physical growth. So, slows down until just before puberty. And puberty, of course, can range all age, some kids hit puberty at 10, some not until their teenage years. So it just depends. But a lot of kids in this age group of development hit puberty somewhere within this span of time. Weight gain is more rapid than an increase in weight. The brain has reached adult size, and muscular coordination is improved. Size is not correlated with emotional maturity. So that's very important because some kids have maybe reached puberty or hit a certain height way before some of their peers. And you'll notice some adults or even teachers treat them differently because they look older. So the assumption is they should know more or behave better and more mature. But that's just not the case, and it builds low self-esteem, and it's detrimental to their psychological well-being. So just keeping that in mind is really key. Um, Gender identity. So sex role development is influenced by parents, typically. Influence of the school environment. Aggressive behavior is often more accepted in boys than girls. And incorporation of traditionally masculine and feminine positive attributes may lead to fuller human functioning. So sex education, um, this is usually when that begins, is this age group, as when they should be educated. Accomplish less by talking or formal instruction than by the whole climate of the home life. Questions should be answered simply. Correct names for genitalia should also be used, no cutesy names. That can cause confusion. And although I feel like this is icky, towards the latter stage of this age group, this can be normal. I shouldn't say common, but normal private masturbation. I'm not a huge fan of saying that, but if they have reached puberty at 10 or 11 or 12, then it's reason enough to assume that this can happen. Sexually transmitted infections or STIs. So again, that's why sex education is important starting in this phase, in this era of development, because that is when they are reaching puberty. So how to prevent STIs is important. Factual and concrete information. It, you know, don't sugarcoat it. Give factual information. Facts concerning harmful effects of drugs and unprotected sex should be communicated without scare tactics. School-related tasks. So parents and children should set realistic goals. Um, they develop heightened awareness um, for things such as, or the parents need to be aware of attendance problems and tardiness, um, and signs of loneliness and depression. Um, Especially there's, now I'm sure a lot of you have heard the epidemic of boys being depressed and suicidal, young boys, which is really tragic. Um, so it's essential that you educate parents to keep an eye on that if there's any change in their behavior. Um, Continue to encourage children to discuss their school problems, their feelings and worries. Encourage them to discuss it openly. And homework should start being the responsibility of the child, not the parent. Um, so the physical, mental, emotional, and social development, they're going to break this down into, or I'm going to break this down into each age of this spectrum because it can vary widely from a 6-year-old to a 12-year-old. So a 6-year-old, more energetic and on the go. They don't always complete things that they start. They talk for a purpose rather than for the sake of talking. Vocabulary is about 2,500 words. And at 6, they require about 11 to 13 hours of sleep. The 7-year-old, that's when they start to set high standards for themselves. They start to develop a humor. Um, they can be more modest and enjoy being active, but also enjoy resting. The 8-year-old wants to do everything. Um, they can play alone for a longer period of time than their 6 and 7-year-old. They become creative and develop creative outlets. They enjoy group activities. And as I think a lot of children do, behave better for company than family. And hero worship is evident starting at this stage. The 9-year-old, they they're more dependable. They show more interest in family, take on more responsibility, are often likely to complete tasks as compared to their younger counterparts, um, better able to accept criticism for their actions. Now, of course, this varies widely on individual basis, but overall, this is the case. Worries and mild compulsions are common. Now we're getting into pre-adolescence, starting with the 10-year-old. Um, Girls are more physically mature than boys, which is typically almost always going to be the case. That's just biology. Begins to show self-direction, wants to be independent, and group ideas are more important than individual ones. And with pre-adolescence, sexual curiosity begins or continues. And then you have the 11 and 12-year-old. Um, can be described as intense, observant, energetic. Um, Very true that they can be argumentative and meddlesome. Hormones can influence their physical growth, as well as their mental, not mental growth, but their mentality. Need freedom from within limits and recognition that they're no longer infants. So they want that autonomy recognized. They want to be seen as an individual that they can do things, and just giving them that sense of independence is important. Play involves increased physical and intellectual skills. Um, Usually the culture of this age group involves membership in some sort of group activity like teams, sports, competitions. It allows them to feel powerful, but also gain some independence. And mastering new skills helps them feel a sense of accomplishment. Um, well, We'll skip over that. Guidance and health supervision. Um, this is where a lot of the ADD, ADHD issues start to become apparent. So if they're inattentive at school, they should be screened for vision or hearing deficits before automatically thinking it's a behavioral issue. Sometimes vision and hearing deficits can be missed even in the earlier developmental stages. I've seen this happen where they were doing poorly in school. It looked like they were inattentive, but really they couldn't hear and they needed hearing aids. So it's important to kind of keep that in mind and educate parents on that. Assessment of physical activity and school performance is important. Health examinations. Um, if they are ill, it's better to give them an explanation of the illness. Um, that helps assure them, lets them know what's going on. Again, there's that freedom, that autonomy. Need time and place to study. So that needs to be set aside. Not all school age children are driven to do that themselves. So you still need to do that as a parent and as the nurse educating the parent. Must learn to take responsibility for their assignments and school supplies. Um, and maybe start giving them an allowance if they do chores around the house, giving them a chore list to make, it one helps them, they get money, but it helps them develop a sense of accomplishment, a sense of helping and being needed. Pet ownership. So pets that have close contact with children can transmit disease. That's a downside. Um, but they often benefit from having pets, especially children with disabilities. Um, any child with allergies or immune issues do not get, instruct the parents, do not get a pet. That's going to exacerbate it, and they're just going to feel miserable every day because they're going to have all of these sinus and allergy issues, puffy eyes. Uh, Infections typically occur from the pet's saliva, feces, or urine, or inhalation. This is especially true with felines, with cats. Risk factors can be further reduced if you educate children not to kiss their pets or sleep in bed with them. That is very important. And perform hand hygiene, of course. All right. That's it for the school age child.